Today, I'm joined by IU Health's CEO, Dennis Murphy. I'm really excited to have Dennis on because the things they're doing to execute on healthcare innovation at scale. Dennis, thanks for being on the show.
Thanks so much, Brad, and a real honor to be here.
Excellent. So today, you're president and CEO of IU Health, but you've led a number of other healthcare systems leading up to this point, including you were a major leader at Johns Hopkins and at University of Chicago Hospitals, Northwestern Memorial Healthcare, and you joined IU Health in 2013 first as COO before moving into the CEO role. And I know you've got a Duke background, and then there's the Notre Dame graduate school that you attended, correct?
Other way around, Notre Dame undergrad, Duke
All right.
graduate school.
In any event, would love to have you share a little bit about the experiences that you've had with these hospitals that were smaller scale. And then we'll segue into talking about this play bigger world that you're in now with IU Health and with 38,000 employees. So I'll turn it over to you, Dennis.
Yeah, thank you, Brad. And it's been, I describe my career a little bit like Forrest Gump. I have kind of moved from place to place, not with any sort of specific strategic plan in mind, but just really great opportunities. And each of them was a little different, but those first three stops were really much smaller health systems. And so when you thought about making major change or trying to solicit feedback as a COO for quite a while in my career, I could do that in an afternoon just walking the halls of the place and having a really good feel. Now I'm part of an organization that has 16 hospitals, 300 clinical sites spread out 3 hours north and 3 hours south and everything in between, that you really have to get more disciplined and structured about how you think about change management. We have a mantra here, how do you go from being a rules-based organization to a values-based organization? And what we mean is you probably can't write rules for everyone, but if you have some very clear values that you stand for, everyone in the organization can get that. You don't need kind of this oversight structure on kind of the corporate culture, that if you're really advancing the culture, it's sort of self-policing when it's really clear and understandable to people. And we found that to be a much more effective change agent for us than kind of lots of policy, strategy, other things. If you keep people pressing, we have 4 key values. It's serve with purpose, compassion, excellence, and be a great team member. Those 4 things have really driven a lot, and each of them has a little more depth below them. I think about excellence. We say do things to the highest level possible and do them in new ways. We sort of embed that notion of innovation in the definition of excellence.
That makes sense. I also think simple is beautiful. And you have 4 values. Actually, that's coincidentally in my career. When I was early on, I've been an entrepreneur and turned into more of an investor. And early on, I thought the whole idea of defining these values was just sort of big company stuff, which I shouldn't even admit that, but I was young, and kind of just thought, hey, just go work hard and do the right things and it'll work out. The problem is when you start hiring more people, you have to have some kind of filter to decide what type of people are going to fit really well within your organization. And I was lucky to read some of the Jim Collins books, like Good to Great, Great by Choice, and so on, and Built to Last. And they talked about how it was all about preserving the core of not only your business strategy, but also your values while stimulating progress. And the fact that really great cultures actually eject people who don't fit like they're a virus. Like it's just obvious that you don't fit. And I think when I started getting into saying we need to define these values as a filter for all of our companies, we landed on 4, which are curious, accountable, collaborative, and ethical. And we have a little acronym called CACE, CACE with the accent. And there's a little dog that, was created to be the Casey dog. And what I like about the 4 is it gives your people a chance to actually know and recite them, which then gives them a chance to really embody them more effectively. And I have to imagine that type of a mindset of simplifying in order to do less better so that you can go further faster. It sounds like that's part of the philosophy. You guys are doing some pretty amazingly huge projects though. Like, I have to ask you about this Flagship hospital facility. I've driven by it recently. I was just like, wow. I mean, for one, it looks like a work of art. It's absolutely cool. And two, I think you probably are going to have not only some of the best technology in there, but also some of the best people that will want to actually be part of that. Talk to me about how that came together, the scale of that, and how it's going.
Yeah, it's a really amazing project. It started out quite simply. We have two hospitals a mile and a half apart from each other that serve all 92 counties in Indiana. And both of them were fairly old facilities that we knew we were going to have to invest a lot in if we were going to maintain them. But really, for us, Brad, one of the most important competitive advantages we have is our talent. And we had our talent separated by a mile and a half, which doesn't seem like much, but on a daily basis, that might as well have been 10 miles or 20 miles apart. And
Right.
so, really trying to make sure we put all of our talent working together and collaboratively in the same place was one of those core goals. The other is, I think maybe for a lot of organizations, you can begin to think parochially, meaning who's your competition, and it's the people you see in your direct market. Whereas we believe our competition is, the hospitals in Chicago, Michigan, Cleveland Clinic, Vanderbilt, Mayo. We are really a national entity and recognized nationally. And so when you look at what those environments are for those other competitors, we were really behind in the facility side. And so this project's kind of amazing. Probably like any big problem, it's actually not one project, it's five. We're very fortunate that we opened our medical school. So, a brand new medical school this past July. So, our first class is in there. We have a central utilities plant that will allow us to be carbon neutral by 2035 open so we can heat the buildings that we are still building this winter. We have a big ambulatory facility and then a hospital that gratefully, just because of kind of efficiencies over time, the new campus will be about 900,000 square feet smaller than the two others because they were collections of old buildings. And so we really do believe this then puts us on a national landscape to then do what we've been doing, but accelerate it, which is how do you attract talent from all over the country and actually all over the world? We recruit that broadly when we're looking for great medical talent.
Yeah, I was recently at the Big Ten championship football game, and there was a surgeon that was in the suite where we were. And talked to this fellow, and he had recently moved to Indiana to work for your health system. And he was just so enthusiastic and excited, which I think is a pretty telling sign. And unfortunately, a lot of people get kind of worn down in healthcare.
Yeah.
It's a 24/7 kind of business, and there are constraints on a lot of different dimensions, and talent is probably the number one. But I'd love to hear from you. In a world where a lot of people can be pessimistic about healthcare, why should people be optimistic about healthcare? What are the things that you could point to say, hey, the way that I see things going, and how they can be evolved into the future, why should people be optimistic about healthcare?
Yeah. So, I'm officially old in the industry now, Brad. I've been doing this for over 35 years. And I always tell people my very first project in healthcare was working with a group of orthopedic surgeons. And the goal was how do you shorten the length of stay for joint replacements? And at that time, it was how could we get from 17 days to 14 days? You fast forward today, we're doing those procedures outpatient. So people go home the same day, they recover, they're back on their feet, and they're having better outcomes. And so, you think about something like that, you think about the reductions. I think there's been over a 60% reductions in heart attacks because of statins. And so I still have immense faith in the technological advancement and development of the business to actually improve human health, to improve life expectancy, And I think what I'm seeing now is people are realizing that's a more complicated equation, that it's not just the care you get inside the four walls of the hospital, but what are you doing in the preventive medicine space? What are you doing with social determinants of health? And I think just the fact that we're having those discussions, we are making investments in them. I actually believe we will improve them. And, Indiana is a great example. 10 years ago, Indiana ranked 44th in the country in the Commonwealth Fund's ranking of states. I think as one of the leading organizations in healthcare in the state, we've made a few things priorities like smoking cessation, infant mortality, behavioral health, and Indiana has moved 10 spots on that ranking. And I do think as states and organizations begin to think holistically about healthcare, we can collectively move the country forward. So I'm wired as an optimist. I think that there hasn't been a day in my career where people haven't said healthcare costs too much. So the cost constraints in the business are a constant for me. They're not something new, it's something you always have to work on. And I think we're blessed with some of the most creative, bright people in the world working inside our four walls that if you give them big problems, they'll come up with creative solutions. So I still remain optimistic. Every year we get smarter. We find ways to cut costs, to improve the product, to improve safety. And I think that's because we've got kind of that core substrate of really talented people that figure it out each year and like the challenge of it.
Yeah, and if you think about where we've come with genomics as well as
Yeah.
in terms of the advancements, my mom passed away from colon cancer back in 2000, and she was in the Cleveland Clinic system. And what I witnessed was there were a lot of really hardworking caregivers, but generally it was a very just standard, this is what we do when somebody has that cancer. Moving forward to now, you can see this differentiation down to you don't just have colon cancer, you have this specific set of biomarkers that allow you to then potentially benefit from a certain precision medicine. I was with a friend recently who is a very successful CEO of a Toma Bravo company. And
Yeah.
he was diagnosed last December, about a year ago now, almost exactly a year ago, with pancreatic cancer. And once they really zeroed in and figured out exactly what type it was, thankfully, there's actually a therapy that allows him to keep that in check. And he's got a friend who's been taking this therapy for like 2 decades, that has allowed him to continue, to live a really normal life. So there's so much promise there. One of the comments you made when we were talking recently, you referred to your view of technology and how to apply technology as one where you're looking for platforms that allow you to deliver value across multiple different vectors versus going with more of a maybe bespoke niche kind of system that can do a thing well, but it takes probably the same amount of lift to implement that, and you just benefit in one way as it would to implement more of a platform. And I think it's an epic EHR that you run on, but then there are other platforms that probably benefit from what you're doing with Epic. Could you talk a bit about that? Because I think it also ties into this managing and leading at scale.
Yeah, well, as a non-tech CEO, so I'm not an informaticist. It's sort of the Achilles heel of trying to understand what are wise investments and which ones are just really expensive and you're not going to see the benefit from. And so, as we think about AI in particular, that notion of platform versus point solutions for us, and it's really not a either or; it's a portfolio discussion of where you're going to make your investments. And so for us, our EMR, which is our electronic health record, is a really important platform that you'd say we want to drive lots of AI solutions that are native in that platform as opposed to coming up with one for scheduling, coming up for one as we think about compliance with diabetes protocols or others. The others that I think are kind of interesting that we talk about are ambient listening and actually ambient video that for both of those, we see really big opportunities to drive multiple kinds of operational improvements by use of those tools. Same thing in our ERP, which is kind of our administrative backbone. How do you actually use your vendors in those spaces to say, hey, I've got 100 problems I think I can use your tools to solve. Let's talk about how we co-develop them. And then we're always going to have some point focal solution. So I just saw an amazing demonstration of a radiology piece of software that actually assists neurosurgeons in understanding surgical margins for brain tumors. So, how big around the area of the tumor do you really need to cut out if you're having a brain surgery? Because that's one of the core questions is you're trying to preserve as much as possible, but you don't want to leave any microscopic cells in that sample. So how do you actually determine that? So I think there's going to be a portfolio. You're trying to figure out how can I lean more of my portfolio in the platform side, but I've got to do some point focal solutions just because the individual returns are so strong, meaning
That's
great
fascinating.
patient outcomes that you want to say our patients are going to get access to that.
What you're describing about that brain surgery, I've seen similar things happening with digital pathology as well. It's a bit of a nuance relative to what you just said, because obviously you don't want to miss anything and you want to make sure that you fully understand what the potential treatments could be based on. People don't realize that for any great treatment to happen, there has to be a companion diagnostic to even know if that's a possibility. And we did a study or were involved with a study that showed about 37% of people who are candidates for precision medicines within oncology specifically never get that medicine because of this lack of ability to scale the kinds of biomarkers you need to test for and understand, and then the way you connect the dots up with whatever that precision medicine is. And I think that's actually another place I see as a huge leap that is going to be happening and is already underway, using these advanced technologies, identifying all these needles in the haystack that are out there that just there aren't enough humans to be able to comb through everything and correlate all these different data points. But I think about it as, the pointillist artist Seurat, who
Yeah.
you look, yeah. So if you zero in on like a segment, you just see a bunch of colors and it's not really anything, but you zoom out and you see this incredible artwork. And I think that's really what the opportunity is with AI and data at scale. And you have to have that EHR backbone where you're capturing all this data. And then once you have it all, though, what are the ways that you can leverage it? And as you pointed out, there are certain solutions that can sit on top of that chassis and generate this incremental value. I know if I'm going in for brain surgery, I'd really prefer to not
Yep.
have any more of my brain removed than I need to. And also, I'd prefer to not have any cancer cells left behind. So that's a really powerful example. So shifting gears a little bit, Indiana University Health is such a major component of the fabric of the state of Indiana. And as you said, it's a national organization, but you've got other areas that scale beyond just the core delivery of care that include the Riley's Children's Foundation, the things that you're doing around philanthropy. I think the healthcare system, while it's dealing with the here and now and today needs of preventative and better, more precise care, better turnaround times and things that make the service better for the patient. But there's this bigger impact you're making. Can you talk a little bit about the philanthropic efforts that you're really leaning into?
Yeah. So, I think we always start by saying we've been here 125 years and we need to be here another 125 years.
Mm.
And all of our founding organizations actually started with philanthropy, whether Riley Children's Hospital was founded by the friends of James Whitcomb Riley, who is a famous poet and wrote Little Orphan Annie. And his friends started a fund to actually take care of children because that's how he made his living.
I had no idea. That is so fascinating. So say that again. So the
Yeah.
the the person who created Little Orphan Annie, who wrote that,
Yep.
was involved with starting the children's hospital.
Correct. And so you kind of go back to Riley's 100 this year. So you go back to the 1920s. Actually, people who were major performers, probably like we would think of Brad Pitt and George Clooney. James Whitcomb Riley was the Brad Pitt of his day.
Hmm.
Performed all over the country, was a fabulous writer, passed away relatively young, and his friends raised money to start a children's hospital 100 years
Interesting.
ago.
Okay. That is fascinating. Okay, great.
And
Go on. I just had to rewind the tape on.
if you're on another Methodist hospital, there was a National Methodist Convention here in Indianapolis around that same time. They actually raised money for that convention. When it was over, they had money left over, and they used that money to start a hospital for the poor here in Indianapolis. And so, again, both of them have this foundation of philanthropy that if you fast forward 100 plus years, what we do routinely is we run a business and an operation that largely can sustain itself on its own revenues and good management. But what philanthropy does is for us is really what we call that margin of excellence. So it is, and I'll give you one great example. We have something called master clinicians that donors fund to allow us to bring really unique talent to our organization. And we have people who are world leading pulmonary experts in pediatric pulmonology, neurosurgeons who are using procedures to actually impact behavioral health issues. We've got cardiovascular surgeons who are coming to think about what are the newest techniques to improve things like heart failure. So for us, philanthropy drives really differentiated programs that you can't get elsewhere in the state, the region, ideally even the country. And so I've been really fortunate. I've partnered with leaders both in the Riley Children's Foundation and the IU Health Foundation. So one raises money for kids, one raises money for adults. And we have gone from raising, you know, 25 to 30 million dollars a year to now over $100 million a year between those two foundations, and that is making a huge difference. So again, none of these things work in isolation. So we talked earlier about the big project being able to attract talent. You can use philanthropy as kind of the gas and the fuel for their programmatic development. And all of it combines to create this world class asset that is an anchor in our state. So, we can't relocate. We don't want to relocate. We are the third largest employer in the state, only behind the state itself and Walmart. And I always say we have better jobs than Walmart. I think
Makes sense.
we are the highest single taxpayer in the state because of our wage and salary taxes that we pay each year. I think you sort of take that responsibility really seriously. Philanthropy is the result of doing really good work, that we have fortunate that we have grateful patients who want to help us continue to do unique things. And so we look at this all as kind of self-reinforcing.
No, it sounds right. And data is such a huge component of all of this. And
Yeah.
whether you're talking about how to allocate resources to support philanthropy in the most impactful way, or you're talking about what you need to do in order to deliver on the value proposition for your patients and identifying those people that need extra support. I'm curious to hear your thoughts on that aspect of the health system strategy. And assume that's a topic you folks work on in your leadership. And there's an organization called Indiana Health Information Exchange as well that I think IU Health has been involved with, and that world has evolved. But talk to me a little bit about the data side of all this.
I think I've learned over time maybe two things. There's no unimportant data. So as much as you can catalog, store, and do that in a consistent, transferable way, that's important. And the more data that's aggregated together or able to work together, the better off you are. And maybe the easiest example is sort of how do you match genotypic data to medical record data so that you can actually characterize what those patients are going through, even though you've got a whole set of genomic data. And those genomic data sets are massive. And so how do you create the infrastructure to actually combine both of those? We're doing a lot of work with a program called Analytics IN. So it's Analytics Indie, and it's really about that data aggregation in as many places as possible. You mentioned iHi. I was fortunate to serve on that board. That was really an interesting collaboration between every hospital in the state saying, we're going to put all our data in one place and we are not going to compete on quality and safety. We're going to use our data to help make the state a healthier place. And I can tell you, Brad, working in some other markets, data amongst competitors being co located would never happen because it was considered too much of a competitive asset that people wanted to hold close. And really remarkable here in Indiana, people got together, and this has been going on now for a long time, predates my time here, that they're seeing the ability for patients' information to go from one health system or hospital to another as more important than the competitive advantage you get. And the ability to keep them safe is what we're all striving for. So we really do believe in how do you digitize as much as possible and then co-locate and aggregate as much as possible, even outside our own four walls as an organization.
Yeah, that's a very good point. That when I reflect back on my mom when she was sick, she had this big folder of information and like a CD-ROM or DVD or something.
Yeah.
And if there was any other specialist that was going to take a look at her situation, all of that stuff had to get sent, and invariably there would be something missing, and just all the time and friction that injected into the process. And operate in a space where the individual has that confidence, and the caregivers that are seeing them have that confidence that they're seeing the complete picture. It relates back to that Surratt example, I think, where all too
Yeah.
often you're only seeing this little piece of the puzzle. And we see this, one of our companies that focuses on identifying care gaps using lab data, that there's so much lab information that's generated, but it's very infrequently looked at in context in that bigger picture over time. And if you look at it in that way, you start seeing that it tells this very rich story of what your health journey is in a manner that allows you to avoid missing care opportunities, that if you can get ahead of the curve, you can deliver something so much better. And what you're describing with IU and those early days of getting the health systems together to say it's the right thing to do, it reminds me of in pharma, where I remember a friend, I think it might have been Dave Ricks sharing this with me years ago, but they have a coalition of competitive pharma companies that all work together to try to make the process of doing clinical trials more efficient and more cost effective, because it's a rising tide thing. And
Yes.
there's nobody is competing anymore on, I'm trying to have a more efficient way than you are and to do a clinical trial. They're trying to compete on the molecules they can get to market and how quickly they can get them out there. And I think that's the same with healthcare, with the provider side that you're talking about, where these health systems were smart enough to say, look, it's a rising tide. If we all have better information, then it gets down to delivering better care through unique aspects of the talent we can attract and the experience that people have. And I remember when I first got into healthcare, my very first company was an e-commerce company. And I went from e-commerce over into healthcare because I went through Ernst & Young doing consulting. And I could not believe that in the most important industry, there was not a focus on how you personalize the experience for the customer at that time at all, But in e-commerce, where you were buying, like, who cares what, a book or something, it was set up to where it treated it like life or death to get you the book on time and give you all the information. Have you seen, as your career over 35 years has played out, an improvement in the personalization of the experience for the individual to where it's a more consumer friendly approach to healthcare?
Yeah, I would say, Brad, there's been improvement, but there are still massive amounts of work to be done. And I do have that same sort of notion of Amazon knows what I read or listened to in my audiobooks and has 10 recommendations for me on others to provide. I think we are an industry that is founded by specialization. And so your Serata example of being very focal on your piece of what's going on with the patient is where people get consumed. And you don't have enough of that pullback and look at something holistically. But I do think we're getting to that point where you're now going to see, and I think again, that platform discussion on AI is really going to make a difference where it'll read your EMR and say, hey, guess what? I know you're supposed to be on a statin, but I haven't seen a prescription refill for you in 110 days, and I gave you a 90-day supply. So why haven't you filled that script? I think you're going to see a lot more proactive prompting, and I think this is going to be maybe the second most important medical device besides a stethoscope. That you're going to see a lot of push emails from your providers telling you, "Hey, we're seeing more of you than we have in the past, and it's not in bits and pieces. And we're starting to string together, hey, here's what you personally need to do to keep yourself healthy." So I'm excited because I do think technology is going to fill these gaps where, again, people individually are all trying to do the right thing, but they lose track of, for us, we've got 1 million unique patients we see every year. How you actually personalize that care, technology is going to have to be a part of that.
Yeah, in my case, I've got my Whoop band and my Aura Ring and my 8 sleep. So it's
Yeah, we
I
should
think
know
about
everything about you.
I mean, there is nothing that I think my high-tech mattress pad knows more about me than I know about myself at this point, but, it is fascinating, though, how we're shifting from this reactive mindset and bringing into the picture these proactive tools that just become part of our daily lives, and we don't think about that as healthcare, really. We think about it's been more of the early adopters have been people who are really into fitness, and
Yeah,
now with Apple Watches and with all this, heck, Whoop now has, and I know others do have, has a program for the integrating laboratory testing in as part of your subscription. So you
yeah,
get a kit that comes to your house and then they can link that. And so I think we're right on the precipice of this very exciting time where healthcare will have this level of personalization. Now you have to want to participate, right? I think that's probably the biggest challenge. And I think also why pharma is so front and center is it's a lot easier to get people to take a pill than it is to get them to change their lifestyle. And that's fine because it gives you a very powerful lever. But then you also run into these situations where you've got multiple specialists prescribing conflicting medications or medications that cancel each other out. We've got a portfolio company called Decision RX that's focusing there, has about 1.3 million members under value-based care health plans, that it's effectively using AI to zero in and say, this person is failing their medications. We can tell based on all these different medication factors and claims and historical data. And then using a concierge pharmacist who intervenes, collaborates with the primary care doctor to get that individual on a more optimal set of medications. And then ultimately, we're seeing that saves the health system or the health plan around $3,200 to $3,600 per year per individual where these meds get optimized. And so it's everybody wins. The patient's healthier and better. And without AI, we really couldn't do that. Like it would be too hard to find
yeah.
those in the haystack. So I'm with you, Dennis. I tend to be a very optimistic, hey, you don't become an entrepreneur or the CEO of the third largest employer in a state if you just sit around and think about how things have always been and just lament that they're not as good as they should be. I think the future is very bright.
Yeah, I couldn't agree more. I think on the technology side, what we find even in our own employee base is those that are most self-aware with their Aura rings or their Apple phone. I'm a Garmin guy, that they tend to be the healthy. And so really, I think the challenge is how do you get those that don't believe they have a way to change their health status or feel stuck? And how do you actually engage them in a way that they are beginning to take control of their own healthcare in the way that, again, most of us who are fortunately healthy feel like that's easy to do. I think there's this emotional side. And again, that's why I believe in our value of compassion. You have to accept people where they are and then say, hey, let's find a way to help you and give you a pathway to a better spot. That'll be the real interesting challenge because I don't think you and I are the target market for kind of big care management companies. We're doing a lot of that ourselves. It's really how are we going to point that and make that more effective for those who really need it.
Yeah, there's no doubt about it. One final question. When is the new hospital going to have the ribbon cutting?
Yep. So first patient seen will be December of 2027. Sort of
Okay.
interestingly, we will get the building turned over to us probably June, July of that year. And I always try and give people a relative sense. There are 52,000 pieces of equipment that will be tied to our network that have to be installed in that building. We have to train all of our employees because again they've been working one building seeing patients that the architect was trained in the Civil War that we are going to move into a 21st century building, and so getting everybody trained so that day one that first patient is got the same level of safety and security and clinical care that we have in our existing buildings. That training activation period takes a bit of time. It's fast approaching. I've got a little calendar in my office with a backwards countdown, and it's going to be here really soon, and we can't wait for it. It's going to be really exciting.
Well, Dennis, it's been an absolute pleasure having you here on Boombostic Health to talk about all that you're doing to lead at scale. Thank you for the great work that you're doing and also for the investments that you're making to be a leader, not only in the state of Indiana, but really across the country to give patients the kind of care model that they deserve.
And thank you, Brad, for the opportunity, but also thank you for what you do to continue to push the envelope and innovate in healthcare. I think it's sort of that great combination of kind of big institutional providers, but we also need innovators, and really grateful for what you and your teams do.
Well, that means a lot. And as always, there's more work ahead of us than behind us in healthcare. But I suppose that also is part of what makes it worth doing every morning and energizing because you're impacting millions of people's lives. And I'll look forward to continuing the conversation here and excited to find ways that we can collaborate together to benefit patients. Thank you, everybody, for being here. I'm your host, Bradley Bostic. Looking forward to seeing you in the new year. Take care.